Hi, Facebook. I hope everybody is having an amazing 4th of July weekend with their families. Um, and I really just wanted to come on here today to talk about a very important subject that is not always talked about. So, and it's not easy for me to talk about, and I know it's not easy for a lot of people to talk about. And that's one of the reasons why I felt that it was so important to come on here and actually talk about it today. So, as a lot of you know, and I have a lot of notes to kind of go back and forth to today. Um, as a lot of you know, I actually just did a speech for OSAP, which is the Organization for Safety, Asbestos, and Prevention. So I got up in front of hundreds of people and I explained my story of how I became blind and how, I was sitting in the dental chair and I had to relive the whole story. So as soon as I got done telling my story and telling what had happened to me, I immediately had to leave the room. In this big convention center. And I had just got an amazing standing ovation and I was completely overwhelmed and I had laughed and cried and relived everything I had just been through. So I had to leave the room right away and I had to go breathe because I felt like my chest was caving in on me. And the reason that I felt that way was because I was diagnosed with post-traumatic stress disorder, PTSD, about 4 months after my injury. And I was seeing a therapist, which I'm not embarrassed about because it was very beneficial. It's very beneficial to go and talk to somebody about issues when you have them. And so I went and I was diagnosed with post-traumatic stress disorder. For me, learning about it and what is this and why do I feel like I'm having a panic attack and I am having panic attacks and I can't sleep at night and certain things just make me relive this moment over and over again in my head, and no matter what happens, I wasn't sure how to stop this feeling that I was having. And you feel so alone at that moment. You're like, oh my gosh, nobody feels what I'm feeling. Nobody, understands what's going on in my head because you don't always understand it. It's a very complex thing. Um, so I came home from Atlanta and I realized that I have PTSD flashbacks usually nightly. For me, it's when I go to lay down in bed and I put my head down, it reminds me of laying in the dental chair. And for that, it's a trigger. And a lot of things with PTSD are what's called triggers. They bring back that moment uh, of trauma for you. And, it makes you relive it again over and over again in your head. And it can bring panic attacks and major anxiety. And a lot of people deal with it in different ways. So for me, that's kind of um, how my PTSD affects me. It affects me at night. It affects me if I smell the smell of dental equipment. Um, there's certain triggers that really affect me. I cannot have anything sharp near me at all. Um, but the sleep thing, and when it's time to go to bed and I think about it over and over again in my head, I will stay up all night. I mean, there is no, other than medication, there's no way for me to deal with this. I've learned to I've learned different methods. One of the things that my therapist had told me, which works really, really well, is, picture yourself in the most beautiful place that you could be to you. And for me, it's always I picture myself on the beach, and I picture my husband and kids in the ocean, and I picture myself sitting in the sand, and I breathe, and I try to get these bad thoughts out of my head, and a lot of times it works, but it does not always work, and I've come to learn that this is just something that I have to learn to live with, because it is something that I experience. PTSD is real. And so in saying that, I came back from the conference, and I had experienced that night after I had spoke, I could not sleep. I was so filled with flashbacks and different emotions about telling my story, and the reaction that I had from all those people. You know, it really hit me hard. And when I got home and I really started to think about this, and I was like, you know, a lot of people have PTSD for many different reasons. And, you know, there's this stigma around it for some reason, that a lot of people don't like to talk about mental health, and they're not always comfortable in talking about mental health. And that's okay, because different people are at different places in their life. And for me, talking about things always makes it easier, because it makes it more validated, and I share my feelings with people because I want them to know that they're not alone. So I get home from Atlanta, and I get a message from a woman whom I had just met. And just so you know, I have 3 very special people to highlight today, and this is just the first. So this is a very impactful, probably tear-jerking live video, and it's all real. And I'm going to read you what these people wrote to me. So let me tell you how I got to that and to the idea. So I come home and I get a message on my Jenn'sVision Facebook page. And it's from a woman that I barely know, and I had just met her. And our kids actually go to school together. And so I literally have had one conversation with her in my life. And she told me and sent me this long message at 2:30 in the morning, because PTSD doesn't have a time frame. It comes whenever it wants to come, and there's nothing you can do about it. So she was up at 2:30 in the morning thinking about things, and she was going through my Facebook page, and because of my honesty with being diagnosed with PTSD, she felt that she was comfortable enough to talk to me about it. And so she sent me a message and poured her heart out to me about her trauma and what she was going through. And it really sparked something in me, and I, felt like, Jen, your purpose, yes, obviously I promote eye protection at the dentist, but I am a patient advocate. I'm a people advocate. I am a people person, and I love people. It's the bottom line. And I love helping them, and it just is good for your heart, and it's good for your soul. So, and I love compassion. So I felt so many feelings when I read her message. And so she's actually the first interview that I'm going to be going over with you. And I will be looking at my phone a little bit, just because I really want to read to you what they have written in their own words back to me. And, like I said, it actually, it's a big part of doing what I'm doing today. So let me see. Her name is Christy, and she had actually, like I said, come to me in the middle of the night. And after I asked her if I could do an interview with her, I got 3 questions together that I was going to ask everyone involved. And the 3 questions that I asked her, the first question, and I asked all of the people the same questions, but the first question is, what traumatic event have you experienced in your life that has led you to live with PTSD? The second question is, how does PTSD affect your everyday? And how do you cope? And the third question is, if you could give any advice to people on how to understand PTSD and what it does to you, what would you say? So I asked her these 3 questions, and these aren't easy to even read. So, but again, this is a very important issue, so it's just not easy. So I asked her the first question, and here's her response. So Christy wrote, the traumatic event in my life which led to my living with PTSD was the death of my 17-year-old son, Michael, and it was nearly 4 years ago. I can't imagine. I have 2 kids, and hearing that first line, I have chills right now, just reading that. My older son, Michael's brother, Christian, he found him, and he ran and got Christy when he found his brother. Christy then, doing what I think any mom would do, tried to resuscitate him over and over and over again. And she tried to bring life back into her son, who was only 17, her baby. Now, she kind of answered questions 2 and 3 together, but again, that's okay. So I really want to read what she wrote. So after she has been trying to resuscitate her son, and they come and declare him deceased, she said, on an everyday basis, PTSD affects me in several ways. The most intrusive way is how all day, every day, I have what I call a movie playing in my mind. And I know that movie that she's talking about. I know that feeling. It's that moment of what happened, and it just goes over and over and over again in your head. It starts with Christian coming to get me, and it goes through the entire event, all the way to Saturday after Michael's funeral. And when I had to leave, and it was over, and I had to leave my baby's body there. Then it starts all over again. I compare it with being in a room and having the TV on. You can to some degree tune it out, and I get that. But sometimes more than others, you really can't. You just can't get that vision out of your head. She really, to number 3, says she feels that in explaining what had happened to her and what she goes through, she feels that it's going to help people to open up about it and talk about it and not feel like they are the only people that are going through this, because they're not. And talking about it is good. And I did on Christy what she has been through. I did, a little bit of research, and just in general, let me give you some statistics, okay? Because these are real statistics, and I actually got these statistics from the National Center for PTSD. And in the United States of America, people between the ages of 18 and 54, there are roughly 8 million PTSD experiences a year. That does not mean that there are just 8 million people with PTSD. Sometimes PTSD might go away for a year, and then it comes back, and it could come back with a vengeance. But every year, 8 million American adults live with PTSD and experience it. So that's a crazy statistic. That's a lot of people. So with Christy, there's a type of PTSD experience that what she went through is called, and it's actually called bereavement experiences after the death of a child. And it's, I'm sure, unfathomable pain, and I can't imagine what that would feel like. Even though I experienced PTSD, it's for something completely different. So I feel for Christy, and I am so glad that you shared your story, and let people know that, because there's so many Americans that this affects because of the same exact way, the loss of a child. And it's a hard thing. It's a very hard thing to go through. So I just want to thank Christy for opening up and telling her story, and sharing with us about what she goes through, and hoping that other people who've been through the same thing understand and know that they're not alone. So with that being said, I'm going to move on to the next interview that I did. And this interview, I have known this girl literally like my whole life. And her name is Amanda. And she has been through something that affects, this is a crazy number. You ready for this? She almost died during childbirth, literally. And each year, well, this statistic is actually from 2015, but roughly between 303,000 women die from childbirth. That's crazy. That is sad. And childbirth is scary to begin with. And so when you talk about childbirth, and you talk about, all the joy you're supposed to feel when childbirth is here, and you're supposed to, it's just, you have all these images in your head of what it's supposed to be like. And when that doesn't always happen, some things can get really, really scary. So, so I asked Amanda the same questions, and her story is a little bit longer, and it goes a little bit more in detail. So she said, okay, so here it goes. When I was 31.5 weeks pregnant, I was admitted to the hospital for severe preeclampsia. It was a healthy and normal pregnancy until that day. The entire time I was there, my blood pressure was high, no matter what meds they gave me. On the third day of my hospitalization, while my family was visiting, I developed sudden difficulty breathing. I felt like I couldn't get any air in, And when I laid down, I felt like I was drowning. I've been a nurse for 12 years, so I knew what was happening. That must have been so scary. I was going into heart failure. All of my vital signs got out of whack, and my oxygen level kept going down, and the breathing got harder to do. I was told I needed an emergency C-section and had to sign consent to be put on a ventilator if needed. I was so swollen from retaining fluids that the nurses couldn't get an IV line in me. I kept thinking, please don't go in my neck. I knew what was happening, and I just kept fighting to breathe. I was so scared, but I knew if I panicked, the breathing would get worse. But I knew if I didn't fight, that I would slip away. My struggle continued through the C-section and all the way until the following night. I was officially diagnosed with PTSD 5 months after my daughter was born. The months following her birth, I had frequent panic attacks. I was terrified to leave the house, and I kept replaying that night over and over and over. There's a pattern with that. And every time I would replay it, my body would have the same reaction. I'm back in that day. I couldn't go anywhere or do anything unless my husband or my mom was with me because I was so afraid of everything. I finally told my doctor what was going on when I had a full-blown panic attack while I was alone with my daughter that almost caused me to pass out. That's really scary. It's really scary. PTSD has changed me a lot. I have limitations on things I will do. Imagine going out to a restaurant or movies and needing to know where the emergency exits are in preparation for an emergency. I always have the feeling something is going wrong, something bad is going to happen. It's not as severe as it was 3 years ago, but it's always there. April, the month it happened, has been very difficult. Trigger. I have lots of flashes and waves of emotions. Sometimes I fixate on just certain parts of that day and I can't stop. I have learned when that happens, I just have to breathe. One technique that is very helpful is called grounding. This is what you should really listen to, because these are special techniques that can help you and help someone if they are having a PTSD episode. You get up, you move around, you rub your arms and legs. Also, there is a 5-4-3-2-1 technique I use. Spot 5 things I see, 4 sounds, 3 things to touch, 2 smells, and 1 deep breath. That's great advice. That is definitely beneficial to people. Number 3, I'll be honest. When I was diagnosed, I was embarrassed. And that is the stigma that I want to help erase, because there is nothing to be embarrassed about at all. I told my doctor I didn't feel what I went through was comparable to a person of war or a victim of violence. I also felt very weak and ashamed that I couldn't get over it. And I know that feeling so well. So well. I want people to know that people with PTSD are not weak or just someone who worries too much. We're not. I am definitely not a weak person, and I know none of these people are. I I want people to know that it's not just someone who has anxiety. Sometimes people, in an attempt to relate or reassure me, will say things like, yeah, I get anxiety too. Although I appreciate that, it's not the same. And I'm telling you, I fully understand your feelings of the anxiety, and it's more than anxiety. It's definitely a lot of what everyone is saying. It's the playing back of that moment, of those moments that are in your head and they don't go away, and they're just there. And no matter what you do, it just keeps replaying over and over and over again. And so, yeah, it does give panic attacks. I've had plenty. It gives anxiety. It gives sleepless nights. It gives a lot of things. So, so you're not alone either. There are so many women out there that have experienced issues with childbirth. People that you can relate to and that can relate to you. And I'm so glad and thankful that you shared your story with me and us and everybody out there, because it's important, like I said, for people to know that they are not alone. And that is one of the biggest things about this community, is that I want people to know that I am always here. I'm always an ear to listen, and there isn't anything that you can't get through if you just aren't afraid to lean on people sometimes. And it's okay to do that. It really is. So the next one that I'm going to talk about is definitely they're all very serious. They are all something that millions of Americans suffer with. But in the research that I did, most Americans suffer actually right now with this type of PTSD. And the numbers that I'm about to read to you are staggering and sad. And yeah. So let's go into Eric. And we're going to go into Eric, and I'm going to go into how I know him and his beautiful wife and lovely family. And but first, before I do that, I kind of want to read a few things about what we're about to talk about. So we're going to talk about veterans from war and PTSD. And I thought that definitely on this July 4th weekend, this was a very important interview to do for a lot of reasons. And I'm going to tell you exactly why. So Eric served in Baghdad, Iraq, in the war. And the percentage for veterans from war who come back with PTSD is higher than any percentage of people experiencing PTSD. So it's between 11 and 20 people out of every 100 that come back from war that experience PTSD. And between 1999 and 2010, suicide was one of the saddest statistics that came out of this article, where women and men diagnosed with PTSD who came back from a war situation, 19.4% of women committed suicide. 38.3% of men committed suicide. This, to me, is eye-opening and lets me know that this is something that we need to talk about and we need to show support for. And that's exactly what I want to do for Eric and his family right now. So I met Eric and Anya because my husband is in the South Philadelphia string band. He's part of the Philadelphia Mummers, and if you are from out of the area, which I see a couple of countries are actually watching right now, so if you're from out of the area, then you need to Google it and look them up, and they make people happy all the time. So I met Eric and Anya a few years back, and this story kind of has a two-turn about it. So Eric isn't as vocal. He's vocal about it, but not as vocal as his wife, Anya, and anyone who knows her knows this about her. She's not going to stay quiet about it. She talks about Eric's PTSD. She talks about what it's like to live with someone that has PTSD. She is his biggest supporter and his medicine. And she's the reason why I even knew that he had it, because her and I would talk about it, and I would talk about my PTSD, and then she would talk about Eric's. And so we kind of started talking, and you know, that's exactly how I realized that that he had it. So talking about this in general is really hard for people to do. Like, I'm sure that everybody that I interviewed and everybody that had to answer the questions, like, they felt this after they answered these questions, and they did this all to bring awareness to people about it and different situations and stigmas that surround it. So I can't imagine how hard it is to just answer these questions, because I know what it's like to be put on the spot and have to relive that moment again, as if you don't relive it enough. So here goes Eric's interview. What traumatic event in your life have you experienced that has led you to live with PTSD? I served in Baghdad, Iraq from 2003 to 2004 with the U.S. Army. Experienced many types of events that caused my PTSD. So right there, you know from that answer that not only is he probably not allowed to talk about those events, but he can talk about those events. And living with something that is hard to share and hard to talk about, it kind of gets stuck in your brain, and you feel like you're living this alone, even though you're not, and it feels that way. It really does. And again, the things he must have saw, I can't imagine. And I do know that he suffers from hearing loss due to these traumatic events. And we have joked before that he's got one good ear and I got one good eye. So he'll keep his eyes out for me and I'll just keep a listen, okay? But he tries to make the best of it. He really does. How does PTSD affect your everyday, and how do you cope? This is a big one. PTSD affects me every day. I always need to know my surroundings and where all the exits are. That sounds, again, very familiar, doesn't it? That's a very common thing with PTSD, is you feel like you need to know how to get out because you feel trapped inside. If a car backfires, and this is a big one, especially for this weekend, and fireworks, and we're going to touch base on that in just a minute. Fireworks. highway overpasses, even cops on the side of the road with a radar gun, all can trigger my PTSD. Let's think about those everyday things that someone has to go through every day, seeing and hearing and thinking of, and seeing them, and that being a trigger. Even smells, which I had talked about earlier. The smell of a dental office makes me want to go into a panic attack. So I'm sure the same goes for him. These triggers, I kind of spoke too soon. These triggers can lead to panic attacks, and they can, and they have. And I, in a completely different way, understand exactly what he's talking about. Some so severe, it can cause me to shut down temporarily. When you're having a panic attack and your PTSD is what you're thinking about, and that's all that's on your mind, and that's all that you can think about, sometimes you just have to you just go into this shell of, I don't want to see anybody, I don't want to talk to anybody, I just want to be alone for a second. I don't understand what I'm feeling, what I'm thinking. There's so many things that go into it. So you mentally go into like shutdown mode. I cope from deep breathing, which is a big one. And it's hard to do that when you're having a panic attack. So imagine the focus you got to try to control this, okay? I call my wife to hear her voice. She can always calm me down. And that just touches me because it shows you the human connection that we all have, and how sometimes when people don't have anything to say and they can't say anything, they just need you to be there and to talk to them and to tell them that it's going to be okay. And Anya does that for him. If you can give any advice to people on how to understand PTSD, what would it be? Just understand that not all wounds are visible. Amen. I could not agree with this more. Mental health is a huge issue, and it's a huge problem, and it's not visible always. And there's so many people that suffer inside with things, and just because they physically don't look disabled to you, or they physically don't look inept of doing something to you, doesn't mean that they aren't. Like, you don't know what people are going through, and that's one of the biggest reasons why I always choose kindness and really try to understand people. It's because you don't know what that person is going through. Be patient and understanding. Yes, patience is a really big part of this, because there is no timeline for PTSD, like a broken arm. 6 weeks in the cast. Do some therapy. It should be better. There is nothing like that for PTSD. It is a lifelong diagnosis, and it's something that you have to learn to live with for the rest of your life. And you can choose, sometimes, you can choose to open up about it and let people know, which is why we're doing this today. And you can choose to say, I live with PTSD. I know what it's like. Let's talk about it, because I want other people to know that they're not alone. Every PTSD, everyone is different and copes differently. And that is so true. that out of the three experiences that were so different today that I went over, they're all so different, and people are coping so differently. But there's a few things that are staples in PTSD, and that is triggers. There are always triggers, and everybody's triggers that are going to set off an episode or set off this PTSD in your head, everybody's triggers are different, and you never know what is going to throw someone into a panic attack. And understanding people, knowing that everyone needs someone is important, and not judging people because you can't see their disability doesn't mean that they don't have one, and you don't know what a person has been through by just looking at them. You have no idea. So to be kind to one another. And I want to thank everybody for taking part in today, and I hope that people with PTSD will watch this and say, I'm not alone. I feel that same thing. I feel that same trigger. I play that movie over in my head again. And if you need someone to reach out to and talk to about it, I'm here. I don't care if you message me at 2:30 in the morning because you need someone to talk to. I might not always be able to get right back to you, but I'm always here to listen and understand that it's something that so many of us go through together, and as long as we have each other, we will never ever stand alone. So I want to thank everybody who took part today, and I want to end this note on something that not everybody realizes or even thinks about, but it is the 4th of July weekend here. See, I got my little flag behind me. And I would like to send out my love, thanks, gratitude to all the men and women who have served and are serving. And Eric's interview really brought something to my attention, which I got to say last year was the first year I really paid attention to it because his wife Anya was posting a lot about it. And I know they have a front lawn sign that they put up, and I know that it's something that might not seem so serious, but it really is. So since it's the 4th of July weekend, it has also been renamed PTSD weekend. And at first I had to kind of, I mean, I know the National Day for PTSD Awareness was June 27th, but 4th of July weekend for us has been named PTSD weekend, and I wasn't really sure as to why, but it's the #1 weekend in America, and like I said, Veterans from War are our largest percentage of PTSD diagnosis in our country. So Veterans from War, when they hear fireworks, it's a trigger. It is an absolute flashback for a lot of people. And I know fireworks are meant to be fun, and I get it. I take my kids to go see fireworks. But the difference is I don't set them off in my yard. I am asking and explaining kind of why, but I'm asking you to please just be courteous of your neighbors. And if you know your neighbor suffers from PTSD, you know they might have just gotten back from the war, you know, you see a front lawn sign that says, you know, please no fireworks, we have someone who lives here with PTSD, please respect that. There's so much that goes into every day trying to live with this that hearing things like that go off right next to your house, I can't imagine what that feeling is. But I know Eric can, and millions of other American soldiers who are living with us. So I want you to please be courteous of that. Go see fireworks and go take your family to celebrate, that's fine. But do it at a designated location. Places where people who have PTSD and suffer from this, they're not going to go to. They're not going to go to the local high school to go see fireworks. And if they do, they're going to be prepared. They're going to mentally prepare themselves for what they're about to experience, which is a big deal. So I just ask you to please be courteous of things like that this weekend, and I still want you to have a blast. Enjoy your family. Life is so short. Every day has to count, and you have to make the best of every day with the people that you love, and even people that you don't know. Show them love, because you don't know what they've been through. And that stranger on the street that you smile and say hi to, they might have had the worst day of their life, and your smile and your hello might have made all of the difference for that person today. So I'm going to wrap this up, and I want everybody to have a fabulous 4th of July and a fabulous life. And please share this video. You never know, because again, not a lot of people talk about it, but you never know who might be silently suffering from PTSD. And let's break that stigma. Let's talk about it. And let's not be ashamed, because I'm here with you. Christy, Amanda, and Eric are here with you. I mean, there's so many people that are here with you. So please don't ever feel alone. Much love to everybody, and I hope you have a fantastic rest of the day. Love, Jenn'sVision.